Hello, it's Jonathan Field, and I want to tell you a bit about a research project that we're about to start, looking at validating a new patient-reported outcome measure called the MSK-HQ, or the Musculoskeletal Health Questionnaire, in a population of private chiropractic clinics. Patient-reported outcome questionnaires are tools that patients complete in which they can describe their health status, and many of these are very condition specific. So we've got specialised ones for knees and for necks and for shoulders and for hips, and they give a doctor an impression of the impact of a condition on a patient's life. And if we get a patient to complete the questionnaire before a procedure and then after a course of care or after a procedure, we can get an idea of the impact that procedures have on hopefully improving the quality of life of the patient. But a problem is, at the moment, we've got lots of different health-related quality of life questionnaires that are used for different conditions. We've got no way to compare one with the other, which means that as people designing services, we don't know, are we getting more value for treatments for shoulder problems than we are for treatment for ankle problems. So Keele University conducted a project which was run and directed by a researcher there, very well-known researcher, Jonathan Hill, and it was funded by NHS England and what was then called Arthritis Research UK. We now know it as Versus Arthritis. And their idea was to develop one MSK-HQ, one patient-reported outcome measure to rule them all. So one health-reported outcome questionnaire that we could use for any condition in the body, so we could compare one with the other. And they did this by interviewing a group of patients, or lots of patients, and find out what they thought was really important about different complaints. And they then interviewed lots of different clinicians from a range of backgrounds. We had medical doctors, we had surgeons, we had allied health professions, people like physiotherapists were interviewed, and all the results were combined and put together. They went through several iterations of these expert groups, looking at the questionnaires and then refining them, and they then wrote it out into a questionnaire, and they then validated this questionnaire by getting lots of patients to complete it, and just checking it, measure what the patients thought was important, that when patients felt their condition had changed, the change were reflected in the questionnaire. It was what's called responsive and valid. Now, the Royal College of Chiropractors have given me a grant to research this questionnaire in community-based private practices. And the reason we want to research that is that we don't know, our patients who present to community-based private practices, do they feel the same conditions are important to them, and when their condition changes, does this questionnaire, the MSK-HQ, does it actually measure those changes accurately? The MSK-HQ, I've got a sample copy of it here. It's got 14 questions. There are 7 questions which ask things which are quite physical. So it asks about pain, it asks about stiffness, it asks about the impact on activities of daily living, like physical activity and work and routine and hobbies and things. And it asks a range about non-physical things, the impact on sleep, emotions, and your confidence in your ability to do things despite the condition, and how well you understand the condition. And the reason we have this blend of physical and non-physical factors is that we've known for quite a long time that it's not just the physical things about a condition. Even if the condition, the main symptom is pain, it's not just the pain, the physical limitation that impacts on our quality of life. So if we have 2 things which are equally painful and make us equally stiff, but one stops us from sleeping, that has a much bigger impact on our life, or if it's making us feel low in mood or stressed, or impacts our relationships. So the idea of this questionnaire, it captures what's called a biopsychosocial, captures the whole lot. Now, the Royal College of Chiropractors, the funders, have been very, very patient with me, and we got these funds about 4 years ago. We haven't yet started data collection, but it's going to start very, very soon. The reason we haven't started data collection is we have issues around recruiting patients and practitioners to be part of the studies in the UK. There have been quite a few large studies going on with PhD students, amongst others, and we haven't wanted to interfere with that data collection. But what we've done is we've written into an electronic patient-reported outcome measure tool called Care Response, what's something that I'm involved in providing. We've written in the ability that clinicians, chiropractors can give patients a web link, and with that web link, patients can actually enrol themselves onto the study. They can sign themselves on, and the computer program will get them to complete a questionnaire before their first visit to the practitioner, and then a month later, and at various time points into the future, without the clinic being involved. So we're not going to burden the chiropractors, we're not going to burden their reception team with extra work, and we're hoping that this is going to mean that we can actually recruit a good group of patients fairly quickly for the study. I can't give you any results yet because we haven't got it, but I will be making a video about it once we get underway, and then again when the results are in.